Warning: these are the symptoms of high sugar in the body. Diabetes is one of the most severe and prevalent health problems in the world. You have to take it very seriously. Hyperglycemia can damage the blood vessels that carry blood to vital organs, which can increase the risk of heart disease, stroke, kidney disease, vision problems, and neurological problems. Diabetes is estimated to affect 9.3% of the world's population. The number of people suffering from this condition has increased continuously in recent years, exceeding 460 million in 2019, almost 100 million more than in 2011. Now we go with 10 symptoms of having high glucose that you should know. 1. Polyuria? Urinate a lot? But a lot. It can be in quantity or quantity of times in the day. It is closely associated with polydipsia, but that is not the cause alone. It is our body trying to get glucose out of the blood through the kidneys. 2. Polydipsia? Like the previous one, it is necessary to dilute the blood sugar concentration by adding liquid. It also helps us to pee more. 3. Polyphagia? Hunger ravenous? We can say that it is a cellular hunger. Our blood sugar is high, hyperglycemia, but inside our cells, we are starving. This happens due to insulin resistance in type 2 diabetics and the absence of it in type 1 diabetes. 4. Weight loss. We see this in serious and uncontrolled cases. They are of no use to a person with diabetes who is trying to identify its signs. Applies to a diabetic debut. People who start with the disease. 5. Side-descended breath. And that? It is nothing other than the smell caused by the famous ketone bodies, which is nothing more than the smell of a byproduct of fat metabolism. Acetoacetic acid, which is supplying us with energy in the absence of the ability to burn sugar. This breath is important to recognize because it is a clear alert that something is not right. 6. Nausea and vomiting. One more way that our body has, which has no education in diabetes, tries to get rid of the glucose that it understands that it has excess. Once again, there is not enough. Our body desperately needs it, but it is not able to send it to the engine room. The cells. 7. Agitation, choking sensation. Hyperglycemia is the high concentration of sugar in the blood. Sugar is sweet and sticky, so the more sugar in the blood, the thick and more difficult it to circulate, making us agitated and gas exchange difficult. 8. Dry mouth, product of dehydration severe side. 9. Weakness. There is no energy in the body. Let's not confuse sugar in the blood with sugar in the bloodstream. It's like saying, the sugar is on the highway, but it never arrives at the office. 10. Confusion. The same as the previous point. If the sugar does not reach the office, let's imagine that it does not reach the headquarters, brain either. In conclusion, all of these high glucose symptoms appear whenever your sugar spikes above 230-250 mg/dl. Many of these symptoms begin to manifest earlier. Sometimes, when we are not managing blood glucose correctly, we get used to some of them. That is why it is essential to measure our sugar levels not only before eating but several times a day to be clear about the behavior of our hormones, and they also play a huge role in our glucose levels. In cases of stress, for example, adrenaline and its henchmen wreak havoc. But beware, when it goes down, the levels go down on their own. If we identify a cause of stress, hydrating well is the first measure, along with calm and water.